remains one of the world's top infectious killers, claiming close to 4,000 lives a day and 1.4 million lives annually.
100 years old. Can lessons be...
Urgent measures should be taken to ensure continuity and recovery of services for timely TB prevention, diagnosis, treatment, and care, in tandem with the COVID-19 response.
Learn from the pandemic and innovations emerging from it.
The impact of the COVID-19 pandemic has been severe, with an additional 1.4 million people estimated to be missing out on access to care in 2020. This takes the total of those who would have missed out on access to TB care in 2020 to over 4 million. Furthermore, an estimated 500,000 excess TB deaths could result due to drops in notifications, setting the world back a decade to the level of TB mortality in 2010.
Question is,
So this shortfall translates into delays in case detection and increased mortality. Left untreated, TB results in about 50% case fatality. About half of the people who have TB, the disease, die from it if they are left untreated.
Thank you. Yes,
Before COVID, 20% of TB cases were attributable to undernutrition, as TB is a disease of poverty. So delays in case detection, in particular with people who have comorbidities, result in excess mortality. And we've modeled that excess mortality to about 500,000 additional TB deaths. So this is an enormous cost of the disruptions due to COVID on health systems and the social changes incurred by responses to COVID.
Research and development to speed up for vaccines.
Systematic screening should be scaled up to help reach all people with TB prevention and care. Improved TB screening using new tools and approaches to reach all people with care could help bridge these gaps, especially by reaching the millions missing out. Systematic screening is critical to ensure we can detect TB early in the people who need it, while also identifying people who could benefit from TB preventive treatment.
it is, what kind of problems are to be expected?
The COVID-19 pandemic has made an already dire situation much worse in terms of reaching all people with TB. So even before the pandemic, we were failing to reach approximately 30% of people. And now, of course, we know it's much worse. So we urgently need strategies to help find all people with TB and get them proper care. One key strategy is systematic screening for tuberculosis. Systematic screening can help find people with TB who would otherwise perhaps be missed because they have little or no access to health care, and it can help overcome those barriers for the most vulnerable populations.
You can identify while screening for TB also other diseases, other lung diseases, and potentially also COVID. And so that's why TB screening is multi-purpose, is one of the recommendations and services that could be broadly implemented, integrated into the primary healthcare services, and can contribute into the strengthening of the health systems in general. We need to build back stronger, learning lessons from the COVID-19 response to ensure more resilient health systems are in place and to advocate for rapid innovations such as vaccines, drugs, and diagnostics. TB vaccine is 100 years old. We can learn from the COVID response to ensure more effective vaccines that can truly drive down the epidemic. We have just 600 days to go to reach the 2022 global TB targets and keep the promises made at the UN high-level meeting on TB.